Monitoring of patients under general anesthesia. Introduction. Welcome to today's session on the monitoring of patients under general anesthesia. As anesthesiologists or nurses, patient safety is our utmost priority, and effective monitoring is the cornerstone of that safety. General anesthesia, by inducing unconsciousness, analgesia, and muscle relaxation, allows us to perform surgeries safely. However, this loss of consciousness also demands that we carefully monitor and manage the patient a trademark's physiological status in real time to avoid complications. In this video, we will explore the critical aspects of anesthesia monitoring, dive into the essential techniques used in clinical practice, and discuss the rationale behind each method. The importance of monitoring. When a patient undergoes general anesthesia, their body a trademark's ability to maintain homeostasis is altered. This is where the anesthesiologist a trademark's role becomes critical by continuously monitoring and adjusting the various physiological parameters, we can prevent adverse events and ensure the patient a trademark's safety throughout the surgical procedure. Monitoring provides us with real-time data to evaluate the patient a trademark's cardiovascular, respiratory, and neurological systems, along with temperature regulation and fluid balance. By interpreting this data accurately, we can make informed decisions that optimize the patient a trademark's recovery and minimize risks. 1. Cardiovascular monitoring. Cardiovascular stability is central to the management of anesthesia. The anesthetic agents we administer can have profound effects on heart rate, blood pressure, and overall circulatory function. At the core of cardiovascular monitoring is the electrocardiogram, ECG. The ECG allows us to continuously track the electrical activity of the heart, helping us detect arrhythmias, ischemia, or other abnormalities that could threaten the patient a trademark's circulatory stability. Given its importance, the ECG is the first line of monitoring in virtually every anesthetic scenario. Alongside ECG monitoring, we continuously monitor blood pressure, which can be measured non-invasively with a cuff or invasively through an arterial catheter. Non-invasive monitoring is commonly used in lower-risk surgeries, providing intermittent blood pressure readings. However, in more complex or high-risk procedures, invasive arterial monitoring is essential. This offers continuous, real-time blood pressure data, which is invaluable for detecting sudden changes in the patient a trademark's circulatory status, especially during significant blood loss or fluid shifts. In certain cases, especially for critically ill patients or complex surgeries, cardiac output monitoring can be vital. Techniques like the pulmonary artery catheter or newer non-invasive methods estimate cardiac output, providing us with detailed insight into the patient's circulatory efficiency and fluid balance. 2. Respiratory monitoring. The respiratory system is another critical area of focus. During general anesthesia, the body a trademark's natural respiratory drive is diminished, so we must actively manage and monitor ventilation and oxygenation. The pulse oximeter is the most common tool for assessing oxygen saturation, SpO2. This non-invasive monitor uses light absorption to measure oxygen levels in the blood, providing a quick indication of whether the patient is adequately oxygenated. Typically, a saturation level between 95% and 100% is considered normal, but certain conditions or patient populations may warrant different targets. Another indispensable tool is end-tidal carbon dioxide, EtCO2 monitoring, which measures the amount of carbon dioxide being exhaled. This provides a real-time reflection of the patient a trademark's ventilation Rising EtCO2 levels may signal hypoventilation or inadequate ventilation, prompting us to adjust the ventilatory support. Capnography, a form of continuous EtCO2 monitoring, is highly valuable during surgery, particularly in assessing the effectiveness of ventilation and detecting any changes in the patient a Euro trademark S respiratory status. It is especially useful in identifying airway obstructions or ventilatory issues early in the procedure. To ensure the patient a Euro trademark S airway remains patent, we also monitor the mechanical aspects of ventilation, including ventilatory pressures. High airway pressures can indicate obstruction or difficulty with ventilation, which requires prompt intervention. The proper placement of airway devices such as an endotracheal tube, ETT, or laryngeal mask airway, LMA, is also confirmed via auscultation and visual inspection, along with monitoring of the ventilator settings. 3. Neurological monitoring. Assessing the depth of anesthesia is one of the most challenging aspects of our practice. We want to ensure the patient is unconscious and free from pain, but not so deeply anesthetized that they experience undesirable side effects or slow recovery. One useful tool in this regard is bispectral index, BIS, monitoring. The BIS monitor gives us a numerical value that reflects the patient a Euro trademark S level of consciousness. It helps us titrate anesthetic drugs, ensuring that the patient stays within the desired anesthetic depth. BIS is particularly beneficial for longer procedures or in cases where the patient a Euro trademark S response to anesthesia may be unpredictable. In surgeries where there is a higher risk of nerve damage a Euro such as spinal surgeries or brain surgery a Euro evoked potential monitoring may be employed. By applying small electrical stimuli to specific body parts, we can assess the function of the nervous system and make adjustments to anesthesia to protect the patient a Euro trademark S neural integrity. 4. Temperature monitoring. Maintaining normal body temperature is a vital component of perioperative care. Hypothermia is a common and serious complication of anesthesia, leading to issues such as coagulopathy, increased infection risk, and delayed drug metabolism. The most accurate method of monitoring core body temperature is through a temperature probe, which can be placed in various locations, such as the esophagus, nasopharynx, or bladder. Monitoring core temperature allows us to detect temperature drops early, enabling timely interventions like warming the patient with forced air systems or warmed intravenous fluids. During long surgeries or those conducted in colder environments, active warming is necessary to prevent inadvertent hypothermia. Forced air warming blankets and warming of fore fluids are common strategies to keep the patient within a safe temperature range. 5. Fluid and electrolyte monitoring. Fluid balance is an often overlooked but critical aspect of anesthesia management. Intraoperative blood loss, changes in body position, and fluid shifts during surgery can all affect the patient's circulatory volume and electrolyte balance. Urine output is a key indicator of kidney function and overall fluid status. During surgery, reduced urine output may signal hypovolemia or renal compromise, prompting fluid resuscitation or adjustments in anesthesia. Additionally, electrolyte levels, especially sodium, potassium, and calcium, must be regularly monitored. Imbalances can lead to dangerous complications like arrhythmias, muscle weakness, or prolonged neuromuscular blockade, so timely interventions are essential to prevent these outcomes. 6. Specialized monitoring in special cases. Certain surgeries and patient populations require additional or specialized monitoring techniques to ensure safety. Obese patients, due to their altered airway and respiratory mechanics. Obese patients require more intensive monitoring. Airway management is paramount, and we may use additional devices like video laryngoscopes or airway pressure monitoring. Pediatric patients, children. A Euro trademark S physiology differs significantly from adults, necessitating careful monitoring of their ventilation and cardiovascular parameters. Pediatric patients are also at higher risk for hypothermia, so temperature monitoring is even more critical. High-risk patients, those with comorbidities like cardiovascular disease, renal dysfunction, or respiratory issues often need invasive monitoring. This may include continuous arterial blood pressure, central venous pressure, and advanced cardiac output measurements. 7. Technological advancements in monitoring. The landscape of anesthesia monitoring has evolved significantly over the past few years. Near-infrared spectroscopy, NIRS, allows us to monitor tissue oxygenation in real time, especially in critically ill patients or those undergoing long surgeries. Ultrasound is another cutting-edge tool used for both vascular access, e.g., guiding central venous catheter placement, and regional anesthesia, e.g., nerve blocks, allowing us to improve the precision of these procedures. Additionally, integrated electronic monitoring systems allow for real-time data sharing between the anesthesia team and other medical personnel. These systems improve communication and ensure that we can act quickly if any issues arise. Conclusion. In conclusion, monitoring patients under general anesthesia is a dynamic and multifaceted process that requires a thorough understanding of the patient. A Euro trademark S physiological parameters and the tools available to assess them. Cardiovascular, respiratory, and neurological monitoring, along with temperature and fluid management, are all indispensable for ensuring patient safety and optimizing surgical outcomes. By using these monitoring techniques effectively, we as anesthesiologists can proactively detect and manage potential complications, ensuring that the patient remains stable throughout the procedure and recovers smoothly. Thank you for joining me in this deep dive into anesthesia monitoring. If you found this information helpful, please consider subscribing and leaving your questions or comments below. I look forward to engaging with you and sharing more content in the future.